Welcome to the Healthy Gut Podcast with Rebecca Coombs, the place where you can learn how to achieve a happy, healthy gut. Here's what's coming up on today's show. On today's episode 19 of the Healthy Gut Podcast, I'm joined by Dr. Whitney Hayes, who is a naturopathic physician and licensed acupuncturist. And an area that she has a great passion for is treating naturopathic gastroenterology. She loves treating irritable bowel syndrome, or IBS as it's known, and all the related things that come along with that diagnosis, as well as many other digestive disorders such as Crohn's and ulcerative colitis. One particular cause of IBS is SIBO, and she has helped many patients with this condition. And she loves focusing on treating children with digestive illnesses as well. In her free time, she enjoys spending time with her wife and her two daughters, and she enjoys hiking with their dog, backpacking, cross-country skiing, gardening, and cooking wonderful meals with friends. Dr. Whitney Hayes talks about her passion for using the tools of both Eastern and Western medicine in her treatment of patients with IBS and SIBO. And she tells us a very interesting story about how her journey was perhaps not the most typical one in becoming a naturopathic physician. And we talk about the different ways that she helps her patients get back to good gut health using a combination of acupuncture, naturopathic supplements, and lifestyle suggestions. So I hope you enjoyed today's episode with Dr. Whitney Hayes. Welcome to the show, Dr. Whitney Hayes. It's so great to have you here today.
Thank you for having me, Rebecca.
My pleasure. Now, as I always start off with my interviews, I'd love to hear the story as to why you trained to be a naturopathic doctor. Like, what was your journey to get to where you are today?
Well, it's, I guess, a different story than I think a lot of people have. I feel like, a lot of my colleagues and friends in school, found their healing journey through, their own illness or someone that they loved. But I found mine through, I guess, a calling that I tried to avoid for a long time. And my mother's side of my family, every one of them is a doctor or a nurse or a pharmacist or some sort of, somebody in the medical profession. And so for a long time, I didn't want to be in medicine. And I tried to, go into other routes. I started college and I always had a knack for science. So I naturally gravitated towards, biology, and I then declared pre-med, which I said I never would, and then I changed it, and then I went on to shift to finally get a degree in botany with a chemistry minor, and so I sort of found my love of plants, and so I thought, I'm going to be a botanist. I'm going to go on to get my PhD in botany, and that's what I'm going to do with my life, and somehow I found my way out to Portland, Oregon. I'm originally from Arkansas, and so a long way from where I was born and raised, and came out here and did a little soul searching and somehow ended up going to Peace Corps. And while I was in Peace Corps, that's actually how I found naturopathic medicine, which seems very bizarre. I went to Peace Corps in Morocco, and I had a friend come visit me there who was actually in acupuncture school at the time. And, I said, part of the reason that I went to Peace Corps was to sort of find myself, I think, how a lot of, young 20-somethings do. And so I told her that I just felt further from that truth after being there for, the year that I'd been there. And she said, you know what? You should become a naturopathic doctor. And I said, what in the world's a naturopathic doctor? I'd never heard of one. So she told me a little bit about it, and then she left, came back to Portland, and I was still there. And I started looking into it while I was there. And I was so drawn to it. And I said, wow, this is exactly how I live my life, how I want to live my life. And so I came back to Portland after my tour in Peace Corps and applied to NCNM, now NUNM, and I had all the prerequisites done because I had all of the, the biology and the botany, and it all just was initially easy and fell into place, and it just seemed like the right thing to do. It's like I didn't even have to think about it. And the first day of orientation, I looked around and I was like, I'm exactly where I'm supposed to be. And so that's kind of how it all started, I guess.
What a wonderful feeling that must have been for you to feel like you'd come to where you should be. That must have been great. Yeah.
It was good to finally figure out what I wanted to do with my life and the direction that I wanted to go. I certainly didn't know where it was going to take me, but it was good to find that calling, even though I tried to avoid it for so long, which is, I guess, ironic. I told myself I'd never be a doctor, but I think it was because the only doctors I had ever known were, and not that they're bad, but medical doctors, and just, your standard doctor that prescribes medications and doesn't really do much else. And it just didn't feel right to me. And that's part of why I changed my, changed from pre-med. And, when I found naturopathic medicine, it just felt so right.
And I'm sure the people of Portland and wherever else you may find yourself living in the future will be eternally grateful for you finding naturopathic medicine.
I sure hope so.
Yeah. So one of the things that you treat is, or we work with people that identify as having irritable bowel syndrome. Can you talk to me a little bit about those types of people and obviously what IBS is for those listeners that may not know much about it or might think that they have it themselves but want a little bit more explanation of what it is and as well what can cause IBS?
Well, I mean, if you go to a standard, gastroenterologist or medical doctor, they'll tell you that, IBS is a diagnosis of exclusion and it's a functional disorder and they don't really know what causes it. Well, I mean, we have learned over the last bit of years that SIBO is probably one of the largest causes of IBS. It's not the only cause, but, probably upwards of 70% of people that have SIBO, that have IBS, it's caused by SIBO. And so, that bacterial overgrowth is a big part of, most cases of IBS. And, I think a lot of people that have IBS, they feel like it's a garbage diagnosis and that it's, because it's a functional disorder that you can't really figure out or find, frank lesions and they've had the whole gamut of workup from their gastroenterologist and, they've had colonoscopies and endoscopies and, all kinds of blood work and everything is normal. And they say, well, why don't I feel normal? And so it gets to be, really frustrating, I think, from the patient's standpoint, because for a long time, many doctors said, well, we can't find anything wrong with you. You must be stressed out. You're anxious. Don't be so stressed out. It's kind of all in your head is what they tell people. And that just, that nobody wants to be told that it's all in their head. So, I think that when we figured out that SIBO is a big cause of IBS, that it sort of gives the power back to the patient and makes them see that, well, it's not all in their head. It's not just, because they're stressed out that their gut's a wreck. So, I think we definitely still have a lot to learn and there's a lot we're going to figure out over time, but it's a good step in the right direction.
It is. I recently met somebody who just in passing said to me, oh gosh, I just have, I'm just that person that always has gut problems. And I recommended that she go and do the Dr. Narala Jacoby here in Australia has a free online quiz you can do on her website that gives you an indication of the likelihood of SIBO. It's not a diagnosis, but it's a good precursor to then going and doing the SIBO breath test. And I said to this lady, why don't you go and do that quiz, and then if it indicates it's likely that you've got SIBO, at least then you can go and find a practitioner who treats SIBO, that knows SIBO, and that you could then go and do the formal testing. And I had an email from her just yesterday saying, oh my gosh, Rebecca, my numbers were off the charts. She's more hydrogen dominant than methane, but she's still got quite a lot of methane present. And she said, I finally have an answer as to what has been going wrong. And then she sent me an email not long after that saying, why do no doctors know about this? And why wasn't I told about this for so many years if this is what was the cause of my IBS? So it's definitely, I think what you say, it's great.
Yeah, it's really empowering for patients to be able to have some answers.
It is, definitely. So can we talk about your experience with treating SIBO? Who are the types of people that come into your practice, and what's your approach to treating this condition?
Well, I definitely have a SIBO heavy patient population. I would say probably 75 to 80% of the patients that I see now are, likely have SIBO. If they haven't already been diagnosed, then I usually diagnose them. So, I would definitely say that the majority of people that I do SIBO tests on, 90% of them probably have a positive breath test. So, that's a big part of my patient population. And, they find me in various different ways, I suppose. A lot of different referrals and whatnot. But, as with IBS and SIBO, many people also have a lot of mental emotional type issues like anxiety and depression and things like that. And they struggle with their mood a lot. And so, sometimes people will come in, for that reason and not really realize that they might have SIBO as well, because maybe the mental emotional aspect is just sort of overcasting some of what they feel like is more of a minor digestive disturbance. Same with, another issue that could be related back to the gut are, a lot of skin issues. I would say 9 out of 10 of my SIBO patients have some related skin issue. So, whether it's acne or psoriasis or eczema or rosacea, there's almost all of them have some sort of skin issue that's flared up at one point in time in their life. So,
and how many of them also have things like restless leg syndrome?
Yeah, some. I wouldn't say that it's a huge percentage of people that I see that have restless leg syndrome, but I know there's a correlation. But it's not a big complaint that people come in with, at least in my practice.
Now, it's interesting that so many of your patients have skin issues or skin disorders, but it's funny how I talk to a lot of people, obviously, in the SIBO world, and there's those of us, and I was one that had huge amounts of restless leg syndrome, but also I had the skin problems as well. I had the full gamut. I had it, you name it, I had it. So when someone comes in and you suspect SIBO, what do you do with them then?
Well, if they haven't already been diagnosed, because I definitely have a good percentage of patients more and more that they've seen other providers that have diagnosed them with SIBO, and maybe they've had some success with treatment or maybe not, and they're maybe seeking a second opinion, or the provider sent them to me as they felt like they exhausted the things that they knew. So I've definitely, as I've started to treat more and more SIBO over the years, I'm getting more and more provider referrals and things like that. So, so I definitely see a lot of that.
Yeah, and so do you, if they have been diagnosed with treatment, what's your approach? Is it diet? Is it supplements? Do you use antibiotics? How do you go about actually reducing those SIBO numbers?
Yeah, so I mean, I utilize all the treatments with people, especially if they've tried, various different ones and haven't had success. So I'll go through the gamut sometimes with some patients. And SIBO for many people is a chronic recurrent condition that needs quite a bit of management. So it's not often the case where it's one and done, that you treat them and they're better for good. That's the, I think, tricky part with IBS and SIBO, especially. So, if they haven't been diagnosed with SIBO already, I'll obviously do a 3-hour lactulose breath test on them and, see if it comes back positive. And most of the time it does. And then we'll go from there. So then, they come in for their visit to go over the test results, and I really just try and lay out the treatment options. So I don't necessarily have a treatment option that I love the most. I try and be the doctor that really just lays out the pros and cons of antibiotics versus herbs versus elemental diet, and just, I try not to choose for them, because I think that that's a part of medicine where we've gone wrong over the years. I think for a long time in sort of standard Western medicine, a lot of people feel like the doctor knows all, and the doctor has all the power, and the doctor makes the decisions, and the doctor prescribes the medicines. And that's not necessarily the best, the best route to go, because we don't know everything, and that's why they call it medical practice, is that we're practicing every day to figure it out with patients. And so it's a journey with patients. And so in order to give them back the power, I really try and empower them and educate them as best I can to make the decisions for themselves. So, that's kind of how I sort of do it, I guess.
And that's wonderful to hear, because so many of us can be so desperate for answers that we want somebody else to fix our problems. And it's really lovely and encouraging to hear that your approach is, no, I want to help empower people to take back that ownership and control of their own healthcare, because it really does feel good once you feel like you're more in control of your health, doesn't it?
Yeah, absolutely.
Yeah. Talk to me a little bit around, so we've talked about the treatment options. Do you find that you need to rotate through treatment options, or do you, let's say someone's gone for antibiotics, if they've done one round of them and they've had some reduction, but perhaps their numbers haven't reduced down to consider a negative SIBO result, what would your approach be with them then?
Well, I mean, it just really depends on how they've reacted to the first round of treatment. I mean, I definitely look at, and I think a lot of people that treat SIBO will look at the breath test results and, the person's symptom picture, and sort of correlate those together. And, if someone's got hydrogen in the hundreds, one round of antibiotics or herbs is not going to do it. And so, it might take multiple rounds. And, but I've also had people with, I treat a fair amount of methane as well, which can be, I'm sure you've learned from people, incredibly hard to treat sometimes. And so, we have to try and implore different tactics. So, I definitely use a fair amount of antibiotics. I use a fair amount of herbs. I try and utilize elemental diet as sort of a last resort with a lot of people. I do give them the option, and most people, don't want to start there, because it's obviously a really hard treatment to do. But I sometimes we have to rotate through with various different herbs and different antibiotics. And if we're not getting a reduction in symptoms, or reduction in gas levels, from breath test, then I start to look and see, well, what are we missing? Are there co-infections there that might be part of the picture? is there a biofilm issue that's just making us not be able to get to get to them? So that's the biofilm is something that I've started employing in my practice a little more recently. I still am a little on the fence about biofilms, but
And why is that?
it's certainly worth trying on those really, really, really hard to treat cases. So,
Why would you say that you're on the fence with biofilms?
well, I definitely utilized in the past a lot of biofilm disruptors that are on the market, supplemental type forms of biofilm disruptors on the market, and I just wasn't seeing, I wasn't seeing a big improvement versus not using them. I didn't see a real difference in using them or not using them. It just didn't seem to make a big difference. So, I guess that's why I was skeptical for a long time. But I have a couple patients right now that I'm utilizing a newer biofilm disruptor that's unlike any of the states. It's a prescription based one, so it's not just a standard one. That's a supplemental one out on the market. So I'm still waiting and seeing, I guess, on that one.
Do you have much coming through your practice in terms of SIFO, small intestinal fungal overgrowth?
Yeah, I definitely feel like that can be a component, for a lot of people. As I was saying earlier, when we're not getting things to budge, we're not getting the numbers come down, we're not getting the symptoms to improve, then I start looking, is there a fungal component to it? Because, that could be a co-infection that's preventing, you know, symptoms to get better and the overgrowth to reduce. So, it's certainly something that I take into consideration. It's hard to definitively diagnose a fungal overgrowth. I mean, because part of it is, there are a certain amount of fungal elements in our digestive tract that are just normal flora. So it should be there, but it's just once it gets over a certain threshold, that's when it can become problematic for people. So it's hard to determine what that threshold is, I think, and it's hard to test for fungus, and just stool testing in general is it's hard to really get a good read on what's going on in the digestive tract, just from a stool sample.
And so, what is your process out of interest to, are you ever able to say? Is it more a case of you saying, "I suspect it's a fungal overgrowth," rather than "I can categorically say it's a fungal overgrowth"? And is it based more on symptoms around suspecting it's fungal issues?
Yeah, I mean, definitely take symptoms into consideration. Sometimes we'll just try and presumptively treat. I do feel like that, a lot of the herbal antifungal routes are very effective. And some of the herbs overlap with SIBO treatments, for bacteria. So, sometimes just using the herbal treatments can be enough to, help rid a fungal overgrowth. But sometimes not. There are some fungal overgrowths that are, resistant to berberine and some of the standard SIBO herbs. So sometimes you have to utilize other antifungals. I've used some prescription ones as well, but I think that the natural herbal remedies and whatnot work just as well. So yeah, it's a lot of it is based on symptoms. If people need a definitive test, I'll sometimes do a stool test, and sometimes it'll come up with fungal overgrowth, and sometimes it won't. So and I tell them that we may or may not find it in the stool sample. So I don't want you to get your hopes up that if it's not there, then that's not the case. And I'll also look at other systems, like if it's a woman, are there is she having vaginal yeast infections, or I'll look at their tongue and see if there's any yeast in the mouth. It's got to be pretty bad for it to show up in the mouth, but or do they struggle with athlete's foot, or other fungal skin issues? Sometimes that can be indicative of if they've just kind of had a lot of fungal things that aren't necessarily gut related come up, then, you might want to go that route.
I think it's there's some really great tips there for the patient population of the SIBO community, and I know that because SIFO has popped up in awareness of SIBO patients, quite often it's discussed vigorously on chat forums around, is it SIFO, is that what I have? So I think that's some really good tips, that if someone is experiencing other fungal type infections, that it may indicate that there may be a SIFO issue as well.
Yeah, for sure.
Around nutrition and food, this is such a big area for people because it's something that we do every single day, and it's also something we can control. What's your approach to the diet that somebody follows when you're treating them with SIBO?
Well, I definitely utilize diet when I'm treating SIBO with people. I think it's an integral part of helping with maintenance and helping with just long-term control of chronic, when people have chronic recurrent SIBO. So I kind of, one of the things that I'll sort of talk when I'm talking about diet to my patients in practice, I'll say, and this is an example that I think a lot of people can understand. And I say, SIBO is having a recurrent chronic case of SIBO is like diabetes in a sense. And, diabetics, you have to manage diabetes. They can't just go out and eat whatever they want. They have to watch what they eat. And so it's not really that different with SIBO. You can't probably just go out and eat whatever you want and eat a standard American diet, or, I mean, nobody should be eating a standard American diet, but, so, they're just going to have to be more careful than probably the majority of the population, which, I think is difficult for a lot of people because they feel weird or odd, or they feel like they're missing out and all of those things. And so it really comes down to, helping them change their mindset around not feeling like they're deprived and missing out on all these things that their friends and family are having. It's more about, focusing on the things that they can have and getting them to change their perspective, and trying to focus on the positive sides of it, which, I think can be difficult for a lot of people. It's, lifestyle changes, and especially diet and the foods that we eat. There's a lot of things that stem from, our childhood and, emotional eating and all of these emotional ties that we have to certain foods and, social aspect to it. So it's a difficult pattern to change for a lot of people. And so it takes time, and it's not something that people are going to change overnight. And so I try and tell people, this is going to take some time. You didn't get here overnight, and so it's not going to change overnight. So you got to be patient with the process.
Is there one type of diet that you feel works better than the others, whether it be at the SIBO specific diet or the SCD diet or the fast track diet? Are there any that you seem to feel that have better results with people, or even are easier to use?
Well, I tend to gravitate towards, I certainly use Dr. Seebecker's SIBO food guide, but I try and not have it be quite as restricted as every single thing on there. So I think I have a bent towards the low FODMAP diet, and I do think that it works fairly well for a lot of people. Obviously not everybody, but, I tell people, you got to find a diet that's going to work for you. Paleo might work for someone, but not another person. And the low FODMAP might work for some, but not another. So you have to find something that you resonate towards, that feels like the right thing to do. And so, a lot of people, I'll sort of give them some guidelines around low FODMAP. And then, and I tell them initially, when we make some diet changes, it's it's best to try and be on the more restricted end, and then, try and expand things over, the course of 1 to 3 months, and to see, what high FODMAP things are, really do aggravate you, because, there's some things on the high FODMAP categories for some people that they do okay with, and then others, don't. And so, that's one of the things that I kind of stress for people. So, yeah, I mean, the diet piece is tricky, and, especially, and this is something I think I've become a lot more aware of in the past couple of years, especially if they have a history of an eating disorder, and that really complicates things. And there's a lot more people out there that have histories of eating disorders than I think people really realize. So it's definitely a question that I ask in, one of my first intakes with patients: any history of eating disorder? If so, where are you at in that process? And, I the suggestions that I'm going to make, I don't want to re-trigger something if you're in a good place with it. And so I think it's an important question to ask patients, and to, make sure that you're not going to cause more harm than good.
It is music to my ears, and I wish more practitioners, and I hope any practitioners listening will incorporate this into their practice, because it is really important. And I myself suffered from disordered eating in my teens, and I remember thinking very clearly when I commenced the SIBO diet that this could be a very slippery slope back into disordered eating. And in fact, when I followed Dr. Narala Jacoby's SIBO biphasic diet for 6 months, and when I was coming off it and starting to reintroduce higher FODMAP foods and bring in more carbohydrate-based foods, I really struggled with it for a while, because I had really enjoyed the strictness of the diet, and I had a lot of fear that I had to overcome around reintroducing foods, and I realized that wasn't healthy. I didn't want to be afraid of food, because I'd been afraid of food when I was younger and had used that in a very negative way. And I think it is really important. And I do see in the SIBO forums people talking about how dealing with SIBO has triggered disordered eating for them again after overcoming it, which makes me sad that that's happening for them.
Yeah, I couldn't agree more.
Yeah. How important do you think that the quality of the food is that we're eating in terms of achieving our ideal or optimal health, or even just getting back to reasonable health?
Well, I mean, I think it's pretty important, because I in the last year I've gotten a little bit more into genomic medicine, and some of my tougher cases that I'm not able to, maybe we've hit a plateau, and not able to really see more improvement when there should be. And so I've started to, I don't want to say dabble, but I've started to utilize a little bit of genomic medicine, and figuring out, are there detox pathways that aren't working? Are there certain biochemical pathways that aren't working? And a lot of what that goes back to, when you're looking at that piece, those the toxic burden that people have, is that we live in a lot more of a toxic world than 100 years ago. And so, being able to decrease the toxic burden on our system is incredibly important. And, it's obviously more important for some people that have a lot more genetic potential of abnormalities than others. So, that's why a lot of people can get away with drinking a bunch of alcohol more than, other people can. But eventually it catches up with you. And so, that's definitely one piece of why I feel like the more that we can, make sure the things that we're taking into our system are, as clean as possible, then the better off, our bodies will be, and the less toxic burden that we're going to be putting into our system, because there's a lot of toxicity out there, and you don't have to be all doom and gloom, but there's certainly ways in which to combat that, and choices that we can make that will help us to be healthier. But food's a great place to start, is to, not put a bunch of processed foods into your body, and, not overindulge in sugar and alcohol and things like that. It's definitely a moderation that needs to happen with those things.
What are some other toxins that people may be exposed to? I think people would generally be aware of things like alcohol and sugar and processed food, so they can see that those things may have a toxic impact. But are there other things that people may like to look at if they're not able to overcome their SIBO perhaps as quickly as they had hoped?
Well, I mean, another piece that's in our water and foods and things like that are, hormones, antibiotics, in certain animal products and things like that. I mean, dairy products, I think if you're going to indulge in dairy products, it should be in a mild to moderate amount, and it also should be of the organic variety. I think that dairy is definitely something that's inundated with a lot of, antibiotics and um, hormones and things like that, we don't need to be taking more of that into our system. Um, I think clean water, I mean, just making sure that you've got a good clean water source that you're drinking from is really important. You know, computers and all the radiation that happens from all the electronics in our world. I mean, that's definitely puts a toxic burden on our system. I'm not saying, put the computer away, but, maybe minimize the amount of time that you're able to be on it. And I mean, there's a lot of ways to combat our toxic world. It's like I said, I'm not trying to be all doom and gloom, but just the more that you can live as clean a lifestyle as possible, the better off we'll all be. But it's hard. It's a hard thing. I have two little kids, and I think about these things with them, and I want them to have a healthy world to live in.
And it is. I often think our poor bodies just haven't haven't had a chance to catch up. We have evolved so quickly with the way we process and manufacture and grow food, and how we live, and the technology surrounding us. Our bodies at a cellular level must be just going, what the hell is happening out there? Like, this didn't used to be this way. Like, even 50 years ago, it wasn't like this. So it's, things have changed enormously. Talking about, we've talked about identifying being unwell and changing what you eat and looking at toxic load. All of that relates to changing your lifestyle, and I know that is something that you work with your patients around, and you're quite passionate about that. Can you share how you approach helping your patients to change these elements in their life, particularly if they've been living a certain way for many years?
Well, I mean, obviously it really depends on the person, and I try and do a really good job of really tailoring and individualizing treatments to people that they're going to giving them a treatment and suggestions that they're going to succeed with. So, with some patients, I might have to start with really small baby steps, such as, maybe we're going to cut gluten out of the diet. And, for some people that's a big deal, and others not a huge deal. So, it really depends on the person as far as how motivated they are, how willing they are to, make changes and feel better. Obviously some people that are really sick are really motivated to make big changes in their lives. So, you just have to really, there were several professors in naturopathic medical school that would use this term, meet the patient where they're at. And I still think about that to this day, to always just meet the person where they're at. Because if you try and give them a treatment plan that, isn't anywhere near where they're at, they're going to fail, and they're going to feel like a failure, and they're not going to come back to see you. So you have to really, you have to take a good history, and you have to really understand where they're at in their life, and what they can do and what they can't do.
That's so important, because it isn't a one size fits all approach to healthcare. And it's so funny that, you talk about when people are sicker, then they're more willing to make changes. And I was that person. I was literally that, like, oh my God, I can't do this anymore. It has to change. And so when I got my SIBO diagnosis, I didn't even hesitate on stripping out foods from my diet, and I stuck to it religiously because I was so desperate to feel better that I didn't care what I had to do. I just wanted to get there. Whereas if if I'd been treated 10 years prior when things weren't as bad, I would have been quite haphazard with it, I'm sure.
Absolutely.
What are some key things around lifestyle that you feel work well? Maybe perhaps sleep or stress management or movement. Are there particular areas that you encourage your patients to work on? Obviously, alongside the physical treatment of SIBO and their nutrition.
Yeah, I would definitely say that stress management is probably, it's probably up there with, with diet. The diet and stress management are probably the two lifestyle things that I try and focus most with people. A lot of people, I guess, in Portland they're probably moving their body fairly decently, maybe sometimes in excess. And so sometimes you have to, counterbalance that, because if someone's, kind of a workout fanatic, and um, they're training for marathons all the time and things like that, then that might not be the best thing for their body, because it's putting their nervous system in this sort of kind of fight or flight mode, that sympathetic dominant fight or flight mode, to where the cortisol's pumping, and they're just it's like, do this, stress all the time. And maybe they also have a job that's very stressful, and so their body's never getting to balance it out with that parasympathetic, or that rest and digest, which is incredibly important. And so that's a piece where I feel like if you don't work on people with their stress management, if stress is a huge component for them, then they're not going to get better. You could do all the SIBO treatments in the world, and they're not going to get better if they're not resting and digesting. And if their digestive system doesn't know how to function properly, it's not going to figure it out when they're stressed out all the time. And so they need to put their body in a state to where they can, know how to, be in that calm, relaxed state. And so, it's not that they can never be stressed out again, or be in that stressful sort of state. It's just, you got to find a good balance between the two, because obviously that sympathetic mode of the nervous system is important. It's important for to drive us to do the things that we do in our lives, but you got to balance it out. And so I really try and help people figure out ways that realistically they can work into their lifestyle, on a daily basis, if possible, because that's what's going to be most effective. And whether that's a yoga routine, or some sort of meditation, or getting acupuncture fairly often is helpful. So it's you just gotta realistically find some techniques that they're actually going to utilize, and not feel like a failure. Again, going back to that, meeting the patient where they're at, and so they don't feel like they're failing at their treatment.
And I'd love to talk more about acupuncture. I'll come to it in a moment. Well, how do you get people to even identify what some of their stresses may be in their life? Is that sometimes a challenge, just to even stop and pause and think of, okay, all these things are really having an impact on me. How do I even start?
Yeah, I mean, some people are very aware of the way that stress is a component in their life, and other people just aren't. Sometimes it takes several visits to kind of even get that. I'll ask about it, and some people are like, yeah, I manage my stress great, it's fine. I go running every day, or something like that. But it's they might not realize even the daily stressors of how it's affecting their body. Because some bodies can tolerate it better than others. So it's sometimes a difficult thing to get people to recognize.
And sometimes people think that they do well on stress as well. I was one of those people. I used to pre-SIBO diagnosis, I should say, because I did have SIBO at this time. I'm certain of it. I used to say I did my best work in a high pressure environment. But since going through my SIBO journey and completely transforming my lifestyle and it's really interesting hearing you talk. I've taken a lot of the toxins out of my diet. So, I used to drink quite heavily. I very rarely drink these days. I ate a lot more processed food than I do now. I've changed my skincare and my makeup and my shampoo and conditioner and all of that stuff to be much lower in chemicals. But my stress levels, I can't tolerate what I used to tolerate. And I don't want to, which is really interesting because 2 years ago or 3 years ago, I thought that I did really, really well on it. And now I can see, I guess because I'm more in tune with my body, I can see the immediate ramifications of being in a high stress situation with me. And I've had to do a lot to change that, including the way I exercised. So I used to do really high energy, high impact, full on training, do at least an hour session. I wouldn't feel happy until I'd felt like I was almost going to vomit. And now I do walking and yoga and meditation and much slower things that 2 years ago I would have laughed at me and said, that's ridiculous exercise. That's not exercise. Do you see that there's a role that exercise and movement plays in adding stress into the body? Can people be doing the wrong kind of exercise for their current health state?
Yeah, I mean, absolutely. If they're not balancing it out, and like I said, it's all about the balance and finding that balance. Which, I mean, Chinese medicine has a great way of sort of looking at that. It's like the yin and the yang, and that's exactly what that sympathetic and parasympathetic parts of our nervous system are. Is that sympathetic stress run from the tiger mode that's the yang. And the flip side of that is the yin, which is the rest and digest in that parasympathetic state. It's the yin, the stillness, the quiet. And so you can't have one without the other. So you have to find the balance in the two, so that they can coexist in a good way. And so, absolutely, if people are, really hardcore, exercisers, and they're just like you were saying with you exercise till you almost vomited. I mean, that's too much. It's not getting not finding a good balance. So it's just, it's not that you can't exercise, because, it's good to go for a run, and it's good to do, some cardio, but you just don't want to do it in excess. And then just, trying to find that balance to bring it back around.
You combine Eastern and Western medicine in your treatments, and you've mentioned acupuncture as an option for helping people calm down. Can you talk a little bit around how that would work with helping reduce stress and perhaps some of benefits of acupuncture for, if there are any, for people with SIBO?
Yeah, I mean, acupuncture is a wonderful tool for a lot of people. It's doesn't work for everybody. I've certainly had patients that I've done acupuncture on, and they're like, I didn't feel a thing. And then, but I would say the majority of people, they'll get up off the table after an acupuncture treatment, and they're like, what did you just do? I feel so calm, so relaxed. My mind is quiet. Can I just do that every day? And, I say, well, sure. But it's important, because it's I think especially in SIBO and people that have IBS, like I said earlier, that they tend to have a lot of, anxiety, depression, mood swings, just various different mood disorders like that, that they struggle with their mood a lot. And I think that acupuncture in Chinese medicine is a good piece to help to balance that mental emotional piece and get them to calm and relax and and not feel so stirred up. So I think it's wonderful from that aspect. I don't I don't necessarily feel like it's going to cure someone's SIBO, especially if they have, a disorder that goes back to, maybe they had food poisoning 10 years ago and they've got damage, to that motility piece. It's probably not going to fix that, but it can certainly um, help to, soothe the nervous system and kind of calm down, if someone's in a more agitated state and whatnot. So I definitely think that it's very complementary.
How does it actually work? I mean, I think most people would have a sense that there's very thin kind of needles, or I don't know if you even call them needles, involved. But can you talk me through the practicalities of how it actually works and how one has an acupuncture treatment, and what does one do if they're terrified of needles?
Well, I've certainly had patients that are terrified of needles, and I've successfully done an acupuncture treatment on them, and they've come back, and they felt like it really helped. So it's I think just the needles are very different than like a blood draw needle, and that's usually the exposure that people have had to needles, and so they're terrified of needles because they've had bad experiences with blood draws. It's absolutely nothing like that. The needles or pens they're tiny, and there's definitely, we have different sizes. There are some larger than others, but they're still not as large as a blood draw needle. So, I if someone's has some fear around it, I just kind of, talk them through it and I have them lay on the table. I have them do a lot of deep breathing and I tell them what I'm doing, and I tell them they can, I can take them out or, stop at any point. So, I try and give them the control in the situation. Um, but I would say the majority of people, how does it work? I don't think we really know. Science is never going to be able to prove how acupuncture fully works. It's definitely an energetic medicine, and it's working on various different energetic meridians to get the energy or the chi to move through the body. And so, to a lot of people, you can't really prove that, and it's not very scientific, and so it must be crazy or it must be bunk. But it works. I mean, it works. I've seen it work. I've utilized it for years on my patients, and I get acupuncture myself, and there's if you've never had acupuncture, and you get it and you feel that sensation of chi moving through the body, it's not like anything that most people will really understand until they get a treatment, and it's a very calm, relaxed state. That yeah, I mean, you can achieve in other ways, through yoga practice and meditation and things like that. But it's it's an energetic medicine like that.
It's funny. One of my goals for this year is to incorporate acupuncture back into my regular life. And my naturopath is in practice with her husband, who's also a naturopath, but he also has studied Chinese medicine, so he does acupuncture. So it's my goal to start seeing him and do some work with him, because I've done it a little bit in the past, but I don't think I've ever done it enough to, I've had a few sort of acupuncture needles put in here and there when I've had a deep tissue massage, for instance, but I don't think I've ever had a proper acupuncture session. So I'm looking forward to experiencing it myself firsthand.
Yeah, I mean, it has a cumulative effect. So it's not like you go in for one treatment and it's all good. There's a cumulative effect to it. So go in for several treatments and really see the benefits of it that way.
That's really good to know, because now I know I need to see Chris a couple of times, well, several times rather than just once, and hope for the best. Dr. Whitney Hayes, it's been an absolute pleasure to have you on the Healthy Gut podcast today. If people would like to connect with you, how can they find you?
Well, I have, like I said, private practice here in Portland, Oregon at integrative clinic called Kuan Yin Healing Arts Center. And I'm at the West Side location. There is an East Side location, but I practice at the West Side location. And so I see patients there. And then I also do Skype consults. I'm not necessarily able to be someone's doctor via a Skype consult, but I certainly am able to, help people with, suggestions and kind of consult with them about, is the direction they're going the right direction, or, what kinds of things should they be looking for, testing for SIBO and whatnot. And people can schedule with me for that through Dr. Seebecker's website on SIBOinfo.com. She has a link on there with my name for that.
Wonderful. Well, all of those links are in the show notes. So if anybody wants to get them, they can head to the show notes. As I said, it's been a pleasure having you on the show. Thanks so much for spending your valuable time and helping educate us SIBOers on all things SIBO. It's been a pleasure.
I've really enjoyed it. Thanks for having me, Rebecca.
That was episode 19 of the Healthy Gut podcast with Dr. Whitney Hayes. I hope you enjoyed the show. If you'd like to get the full transcription or even just the show notes with the links to be able to connect with Dr. Whitney Hayes, simply head to thehealthygut.co/east-west, and you'll be able to download all of them from there. Now, I absolutely love hearing your feedback, so don't forget to leave a rating and review on iTunes or the app you use to listen to this podcast, and do share it with your friends. If you know anybody that is suffering from irritable bowel syndrome and might like to learn a little bit more about it and what an underlying cause could be, it would be great if you could share it with them. And you can follow us on Facebook, Instagram, Twitter, YouTube, Pinterest, and Google+. Just look for us under The Healthy Gut. Now, over the last couple of weeks, I've been telling you that the SIBO coaching program is coming, and I have opened up registrations for people to tell me that they're interested in learning more. I do only have a limited number of places on the coaching program, so if you think this is something that you would benefit from and you haven't yet registered your interest, make sure you head to thehealthygut.co/interest. There's no obligation to sign up to the program at this stage. All it does is let me know you're interested in learning more. Coming up on next week's show, we're joined by Dr. Jason Klopp, who has developed the CLEAR protocol, CLEAR, and he uses it to support his SIBO patients' return to health. It's a fascinating chat with Dr. Jason Klopp. I'm sure you will find it really beneficial as well. So stay tuned next Tuesday for that interview on episode 20. You've been listening to the Healthy Gut podcast with your host, Rebecca Coombs. To learn more about the Healthy Gut or our podcast, head to thehealthygut.co/podcast. And as we are fully funding this podcast, if you would like to help support the continuation of this podcast so that we can continue to bring you future episodes, all you need to do is make a contribution at thehealthygut.co/podcast. We would like to thank Belinda Coombs for the production, editing, and original music score of this podcast. To hear more of Belinda's music, head to soundcloud.com/Belinda Coombs. The Healthy Gut podcast is a production of The Healthy Gut. Thanks for listening.